I'm really excited about our lung cancer screening series that we just launched. It highlights a very important topic that could have a huge impact on saving patient lives and improving quality of life. Most people don't realize that lung cancer is actually the leading case of cancer deaths for both men and women in the United States and across the world. A lot of people we hear a lot about breast cancer awareness and these other fields, and it's actually lung cancer that is well positioned to have a huge impact to save lives. And there's also been a lot of advancements in treatment in lung cancer in the last couple decades with cancer immunotherapy and other options that patients have now. So really the intersection of screening more patients, identifying those patients, and having better treatment options can have a huge impact. So early detection is key to that survival impact that we could have. And what I love about the field that we're in here at Medality is that radiologists can really have a key role in not only identifying those lung cancer nodules, but also advocating for better screening protocols, screening programs in their practices so that we can decrease the barriers to being able to screen more people that are at risk. Yeah, Dr. Kazerooni was just wonderful to work with. It's here at Medality, when we find faculty with such passion like hers, it really gets us all very excited about the work that we're doing here. And she has a great passion for lung cancer screening advocacy, and it opened our eyes into the impact that this education could really have. And I loved the approach that she took to teaching the topic also. So she gave both foundational knowledge and kind of touched on some of the advocacy and the history behind the screening guidelines. But then also she took a very practical case review approach that can help radiologists understand the role and the impact they can have, not only on the big picture, but in the day-to-day and what they're doing. Yeah, so you touched on a little bit how there's both a fundamentals and a mastery course. So the fundamentals course will help give people a great overview on the guidelines and how to use lung rad scoring properly in how they are interpreting the cases. And then radiologists can go deeper in that lung cancer screening mastery course, where they're going to see over 40 chest CT cases with Dr. Kazerooni teaching her search pattern and how she approached and worked through every single one of those cases. Yeah, you come upon these courses from time to time, and it shows you the work we do here at Medality, how it can really touch us personally in so many ways. So in working with Dr. Kazerooni on this course, it helped me realize that my father was actually eligible for screening, and yet he had never been screened. So it brought forth an interesting dinner conversation about him getting screened, and I encouraged him to talk to his doctor about it. And we were able to get his results in a couple months. For in his case, a result that did not show lung cancer, but it really showed how much advocacy plays into this area, and we should all really be thinking about the ways that we can help. Yeah, being in the field of radiology medical education, I would say my hope is that radiologists will feel empowered by these courses, not only to learn the skills that they need for their daily practice, but really to also think about how they can be advocating for improvements in the screening programs at their institutions and their imaging practices. Like radiologists sit at a really important intersection to having that impact on both sides.